Hi, it's Uzo Ehiok here at Integrated Clinical Strength and Conditioning. So the call to action this week is to discard your yellow ThyroBands because they have no place in muscle and tendon rehabilitation, except for maybe a very few exceptions. So what is elastic resistance training? In essence, it's a modality that we use in clinical practice all the time. And if you're like me, you grew up as a young student and as a junior physiotherapist, always using these yellow bands if you could find them in your department. Now, what is a yellow band? Or sorry, what is an elastic band? Basically, an elastic band, a resistance band, whatever you want to call it, it's a form of variable resistance training. The whole point of it really is that you can provide maximum or minimum load at various points throughout the range of motion, essentially by manipulating the tension of the band. So you pull it tight and you let it come in again. That's essentially how it works. But why would we use it anyway in the first place? Well, fundamentally, as physical therapists or physiotherapists, our one goal is to improve tissue health for function. Let me say that again. Our one role is to improve tissue health for function. And what we use in essence is we use the principle of mechanotransduction. Okay, so we apply a force to tissues, which then essentially, okay, for want of a better phrase, send signals, okay, at a molecular level and a cellular level, and causes a change, a structural change rather, in tissues at both a societal and an activity level. So in essence, we improve function via mechanotransduction by the use of force. And this is a key principle that will keep coming up throughout this presentation, the application of force. So in terms of management considerations and why you should or shouldn't use a yellow ThyroBand, which of course I think you shouldn't use a yellow ThyroBand, but okay, the key thing we need to do is we need to define our outcome. Okay, and what I mean by that, in essence, is we need to decide what is it we are trying to achieve. Now, for the purposes of today, I am talking about improving muscle, tendon, and connective tissue mass. So we're talking about morphological changes, changes in the structure. You cannot do that with a yellow ThyroBand, so stop using it. Okay, the method that we would really use, I guess, if we're looking at it from a strength and conditioning perspective or training perspective, or sports science perspective, is going to be hypertrophy training, because that's really where most of the evidence sort of lies. It's basically saying, okay, this is how we need to load these tissues, okay, if we're looking to change essentially the morphological characteristics and to a lesser extent the material properties of those particular tissues. So in essence, if we can do that, then fundamentally what we're trying to drive mechanistically, okay, at a cellular level is an increase in the cross-sectional area of those tissues. If we can do that, then that is also associated with an increase in force production. Now, but the key thing here is we are applying force to tissues, and they're going to be therapeutic, but we need to apply force nonetheless. So let's have a look at some of the science that underpins essentially how much force you might produce with a band. So in essence, if you look through this chart here, what you'll see is we go from yellow to black. Okay, and in essence, the numbers are not that high, are they? So what are we aiming to do? What we're aiming to do is we're aiming to take a band from one size and we're going to elongate it and we're going to stretch it. As we stretch that band, okay, we essentially place that band under greater degrees of tension, which that tension is then imparted into muscle, because the muscle has to produce force in order to stretch the band. Hence, that's our little circular loop. But wait, when we look at the numbers and we interrogate the numbers, just how much force or how much force in kilograms are we actually able to produce, or a muscle is able to produce, when we elongate a yellow ThyroBand? Well, fundamentally, if you look at it here, it's about a kilogram. Yeah, it's about a kilogram of load. okay, to try and cause adaptations. Now, that's not very high. I think you can see, even when you've elongated that band up to about 100%. Now, there's going to be some people that are going to say, yeah, but I just use it at the start of their rehab, in order to try to get some adaptations. Well, what adaptations are you trying to get? Yeah, like the key thing here is it's load and force. So you want to apply load and force to those tissues. Okay, the tissues will adapt if you apply appropriate levels of load and force. My argument here is a kilogram of load is probably, I would argue, is definitely not enough to cause any sensible changes or reasonable changes in connective tissue, muscle, tendon, and tendon mass. Yeah, you need to really be up in the black zone, okay? Which is actually, if you look at it at 100% elongation, it's still only 3 kilograms. Yeah. If you double the band, then you get 5 kilograms. Now we're starting to see something that looks relatively reasonable. Okay. If our goal is to improve muscle and tendon and connective tissue mass. And let's have a look at some of the contemporary literature that essentially supports or tells us or gives us some idea about how we might develop muscle, tendon, and connective tissue mass. Now, admittedly, most of this work has come from hypertrophy of muscle. And that's okay because it provides us with a vehicle, okay, to use for tendon and connective tissue. Because ultimately, it's still about the production of force, okay, to load tissues. So, what are the physiological mechanisms essentially that drive adaptations in terms of tissue, hypertrophy? Essentially, muscle tension seems to be the key driver. We also have hypotheses around muscle damage. So there's the muscle damage hypothesis. And there's also hypotheses around metabolic accumulation. So what does this actually mean for you clinically? Well, it's this really. If you go down the tension road, then actually the load is going to be very, very high, okay? And the number of repetitions is going to be very, very low. What that's going to drive, in essence, okay, if we go down the tension road, is neurological adaptations, which are going to be short-lived. Yeah, so you're not actually going to get any real structural changes because what we're driving is the nervous system, okay, to be more efficient, multi-unit recruitment, efficiency, rate coding, and so on and so forth. Now, if you go down the metabolic accumulation road, that's going to be very unpleasant for your patients. They're not going to enjoy it and they're not going to like you because essentially what you're driving is a high concentration of lactic acid and also hydrogen ion. But that's going to be up at the upper realms of the 15 to 20 and above load. Okay. So really what most of the evidence is saying to us is we kind of need to be somewhere in the middle. So we need to be around that 10. Yes, 10 reps is okay. It's okay to do 10 reps as long as you don't have any reps in reserve. Okay, but essentially what we're looking at, guys, is you need to be around that sort of 10 to 12 repetition, okay, because that kind of gets you the best of both worlds. It gets you enough tension, okay, which is a key driver for adaptation, and also it gets you some metabolic accumulation as well, okay. So that's really where we need to be. So what are the underlying adaptations? The drivers for change in terms of tissue, connective tissue, muscular tissue, and tendon tissue, okay, is this idea and concept of metabolic signaling. Okay, that's really what we're looking for, and that's what we're trying to drive, okay, when we use our bands. Now, you ain't going to get any metabolic signaling, okay, using a yellow band. Let's be absolutely honest here. It just doesn't make any sense at all. So let's talk through a very quick case study. So this is one of our patients. This is Talia, okay, and she'd been with us for about 6-7 months. And when we first met, she had quite profound multidirectional instability. At no point did we use the yellow fireband, incidentally. But we did move, okay, through the scale. And what you see her here essentially is using a double a double ThorA band. Okay, we've got a ThorA band essentially doubled over, and she's doing some work here. Okay, external rotation essentially with the band. Okay, through range. You can see her shaking at the end. Okay, she holds isometrically and then she comes back. Okay, with a little bit of time and attention. Okay, but the key thing here is it's a black band. It's a black band because we're trying to drive adaptations, okay, in terms of muscle cross-sectional area. Okay, to take things a step further, okay, as we progressed, okay, through her rehabilitation, we progressed on to extenuated eccentric strength training. Okay, and the key thing here is it's as the name suggests. So what we know is that when we use a eccentric muscle modality, or we use a eccentric muscle action, what we see and what we know from the research is that we can expect really between 20 to 60% more muscle tension being developed, okay, at any given velocity. So that's at any given speed. Okay, and that's when compared to isometric muscle actions and also concentric muscle actions. Okay, what we see here with Talia, okay, this is quite a neat little exercise, really. I quite like this. It's quite nice. And essentially what we're doing is we're using Talia's leg, okay, to tension the band. And in essence, we're just driving for eccentric adaptations. Okay, so in the concentric phase, what you'll see is that she doesn't actually have to do any concentric work. Okay, so we're saving her really for that eccentric work, and what you'll see this just in a moment. Okay, so she uses her foot to tension the band and she holds it in position isometrically, so a nice isometric load, and then she comes down into external rotation whilst keeping her foot in the same position. A lovely accentuated eccentric strength training exercise. So again, she pushes her foot out to tension the band. Yeah, so we've got about 100% elongation, give or take. Okay, and then she starts to rotate around like so. This is a beautiful exercise. I really love it, actually. Okay, and that's such good control for a patient that had multi-directional instability. And in essence, she would pick up her bag from the floor and, basically she would sublux her joint. Okay, opening cupboards, okay, at 90 degrees, she would sublux her joint. It would just pop out. Okay. So this is really good. Okay, but there is a time and a place for a yellow ThorA band, and to my mind, there's only really one time and place, and that time and place, in essence, okay, is really to augment another exercise. So, and what we can see here is, okay, we've got some literature to support this. Okay, if you want to augment, okay, a normal activity or a normal exercise, such as a squat or such as using dumbbells, essentially what you do is you wrap the band around, okay, the said weight. Okay, and you move through that range of motion. So essentially, when you get to the top of the range, concentrically, okay, what you'll see is that the band is tight. Okay, so that increases the amount of training load, okay, applied to that muscle. And for me, that's probably the only time where a yellow ThorA band really has any utility in a muscle and tendon mass, or muscle tendon connective tissue mass program. So in conclusion, muscle, tendon, and tendon mass adaptations, it's governed by tension, okay? But it's really important to define your outcome. If you define your outcome from the start, then actually it makes it so much easier, okay, to clinically reason and to select what it is you wish to do. And so, my big argument and my call to action to you guys is, okay, please don't underload the patient's tissues. Aim high, start high. Okay, if pain modulation is your outcome, then use a pain modulation technique. Don't use a yellow ThorA band. Yeah, okay, define your outcome. Okay, and let's push our patients so that actually we can get them back to doing the things that they want to do as quickly and as safely as possible. Here's some references, okay, for those of you that wish to continue reading. and learning. And also, don't forget to subscribe, join our community. Okay, visit our website. It's www.integratedclinicalsandc.com. Okay, you'll also find us on Instagram, Integrated Clinical S and C, and also you can follow me on Twitter, should you wish to, at Consultant PT. Thanks for listening, and like I said, don't forget to join our community, subscribe, okay, and just be amazing musculoskeletal physiotherapists.